Tylenol is not a painkiller. It can help get your fever down. It might have marginal effects on a migraine. By the way, for those of you across the pond, that's paracetamol, same stuff. It is a drug that is so ubiquitous that I cannot ever remember either being taught about it in medical school or elsewhere. Acetaminophen is. It requires no further explanation. Acetonilide is an old analgesic. Acetonilide is metabolized to acetaminophen, the sort of, kind of, perhaps, maybe active molecule. I guess they assumed that since acetonilide was an analgesic, so was acetaminophen. But when I look for anything that resembles proof of analgesia for acetonilide, I cannot find much. Its analgesic power is not a very powerful one, but it has the enormous advantages of being free from the disturbance and inconveniences that are associated with the action of nearly all other pain-subduing agents, and for the dangers inseparable from the use of the more powerful of these agents. They're talking about opiates. So it wasn't so much that it was a painkiller, it's that you didn't have the evil addiction problem from those evil opioids. It was assumed for a long time that acetaminophen was an analgesic based on little to no clinical data. Acetaminophen is the worst of all the analgesics, barely better than or equal to placebo. Least effective quartile of drugs for treating acute post-operative pain. So stop doing that! Oh, you got arthritis? Just take some Tylenol. It's not going to work. And there is no review evidence that paracetamol works for menstrual pain, neck pain, rheumatoid arthritis, or cancer pain. Acetaminophen to preoperative preemptive multimodal analgesia did not decrease postoperative morphine use or ameliorate pain relief, which is consistent with the overall literature on acetaminophen and pain. It does little to nothing. It doesn't work. It's not a pain reliever. I would wager using Tylenol for pain is too ingrained in society to be amenable to change. So acetaminophen will continue to be the most commonly used ineffective drug for pain. If you're a doctor or a nurse and you've got a patient in pain and you give them Tylenol instead of opioids, you are evil. You are not doing your job. You are violating your oath. You are committing malpractice because you are deliberately torturing patients by denying them the only actual painkiller we have. And that option is not bad. 99.4% of them will never become addicted. So just stop it. Please. For the love of all that is good in this world, just stop it. And let people have their pain medicine.